Welcome to the Hashimoto's Doctor Podcast. You're now part of a growing community of people determined to take their health back through education and self-empowerment. But because of the healthcare system today, we don't have access to the types of healthcare that we want. So we have to do things differently. We've got to do things smarter, and we do that by becoming our own advocates. This podcast will give you the perspective and thoughts of one of the world's leading Hashimoto's doctors. So let's get started. Hey guys, Dr. Shook here. I hope you're doing well today. What I want to talk to you guys about on this podcast is really revolves around addressing hormones. Hormones, in particular, I'm talking about estrogen, progesterone, and testosterone. Your male and female sex hormones, which a lot of people, they have low libido, they have excessive body weight or weight gain, and they have problems with motivation, and they go to their doctors, and the doctor says, well, maybe it's your hormones. They do a test, and sure enough, the hormones there's an imbalance, and they're prescribed some type of hormone replacement. And really, I know that approach has helped a lot of people, but at the same time, that approach is inadequate. It's not a thorough enough investigation, in my opinion, to make sure that's the needed approach. And really it's, why are the hormones the way they are is my question. Why is testosterone low? Why is estrogen low? Why is the progesterone low? And a lot of people will say, well, you're getting older and these levels are dropping. And you know what? To some degree that may be reasonable. However, you still have to look at the other factors that can drive and create an imbalance with these hormones. And there are many. And so here's the first thing I want to share with you. If you attempt to address sex hormones, testosterone, estrogen, and even, progesterone, and you do not address blood sugar dysregulation and anything that can be promoting an adrenal gland disorder or stress response, then you are going to be missing a big piece of the reason that your hormones are not normal or are not balanced. So what I mean by that is, when you start to look at this, there are several different things can affect your body's ability to produce your testosterone, your estrogen, and these hormones. And if you have blood sugar fluctuations, that will wreak havoc on the hormones. And I don't know if you've heard my other podcasts. If you haven't, you need to go back and look at some of the earlier podcasts because I go into this in more detail. But basically, the bottom line is that fluctuations in blood sugar up and down have several different physiological effects on your hormone production. And like low blood sugar, for example, will cause your body to make more cortisol in an attempt to bring the blood sugar levels up. Now, that will steal away a hormone called pregnenolone from your hormone pathways, and your sex hormones, your testosterone, your estrogen, and progesterone can be imbalanced. Now, depending on what else is occurring in your body, you'll see different variations of that. However, you've got to look at this problem more completely. You can't just look at these sex hormones by themselves and expect to have the answer, because that's not the whole physiological picture. And taking some of these hormones could be the absolute worst thing for you to do. So, and I'll get to that in a second, especially when we talk about men. So, all right, the blood sugar is one effect. Now, if blood sugar is too high and you have higher insulin, or if you're having insulin surges, which can also occur with hypoglycemia or lower blood sugar, then you will actually increase some of the enzymes that convert, for example, DHEA, which is one of your hormones, we talked about it a lot in the last podcast, into testosterone. And it can actually push these hormones more towards your androgens, like androstenedione and testosterone. Now, if you're a woman, that's absolutely the worst thing for you, right? Because that's one of the ways that we develop polycystic ovarian syndrome, or PCOS. Fluctuations in blood sugar change these enzymes, force our chemistry and our hormone physiology more towards the androgen state, or towards these androgenic testosterone and androstenedione, these hormones, which cause all these problems with hair growth and lead to a ton of different problems. So you've got to address blood sugar. That's one huge thing. And so when you start looking at blood sugar, I'm going to tell you, as with everything we discuss, there are multiple factors affecting blood sugar. It's not just diet and it's not just exercise. Really, the biggest things I see missed with blood sugar, because I've worked with a tremendous number of type 2 diabetics, tremendous number, and the thing that's missed most frequently is the fact that cortisol, the stress hormone cortisol, and inflammatory levels are not being assessed and worked through appropriately, because those things will promote higher blood sugar and higher insulin. So you have to look at those. You have to look at your inflammatory levels and what's driving that. You have to look at cortisol. If it's too high, you have to understand what's driving the adrenal stress response and causing you to produce cortisol. So blood sugar will wreak havoc on your sex hormones. Wreak havoc, absolutely. Now, the other thing is what else drives the adrenals? Well, one of the other things is anything that can produce inflammation is going to stress and activate the adrenal glands. And the reason that that's important, obviously, is because if you produce cortisol excessively, which is produced by the adrenals, you will deplete your steroid hormone, pregnenolone. Now, pregnenolone is really important because it's required for you to make your testosterone and your estrogen and your progesterone, and it will create major issues. So the thing that we've got to do is we've got to look at things that can drive inflammation. Is there an inflammatory process? So are you reacting to foods? Do you have a food sensitivity? Are you reacting to pathogens, bacteria, yeast, viruses, parasites? Is there a pathogen? Are you reacting to environmental chemicals? Because chemicals can also drive an immune response and produce inflammation. So we've got to assess that. If you really want to try to get to the bottom of this, you've got to look at the whole picture. So yes, an environmental chemical could be creating a hormonal problem due to inflammation. It could also be disrupting your hormonal physiology, because there are all kinds of environmental chemicals that are obesogens and endocrine system disruptors. Those are all real things that can occur and create some major issues for you. So you've got to look at things that drive inflammation. So what stresses the adrenals? Inflammation. What drives inflammation? Well, a lot of the things I just mentioned. What else stresses the adrenals? Well, physical pain will stress the adrenals because it stimulates a sympathetic nervous system response and produces cortisol. That can stress the adrenals. That can deplete you of pregnenolone, that important hormone that's a precursor or that comes before testosterone, estrogen, and progesterone. So that will throw off those hormones. So let me ask you the question. Is going to your doctor and getting those levels checked the answer? And then taking a supplement? Or is going to the anti-aging clinic and getting those hormone levels checked and just taking what they give you the answer? Do you think that if you're taking those hormones, and I'm not saying that those hormones aren't necessary for some people, but I will tell you this, I disagree with the just across the board administration of these hormones for low levels without thought or thinking through the physiology of why they're low. If you're going to take these hormones, then you need to have every hormone that's produced in the body is signaled. So let's say your ovaries are producing estrogen. Well, you need to check the brain hormones. You need to check the pituitary gland hormones and see if they are being produced to signal your ovaries to make the hormones. Because if you've lost pituitary gland feedback, then that's a big issue. You have to look at the entire hormonal feedback loop. You have to assess these other problems, or you are going to be taking hormones that could be very detrimental to your health, and you may not be treating the root cause of the problem. So if you want true health, if you want vibrant health, you have to think about the physiology and the real reason behind why you're doing what you're doing. If you don't do that, then you could set yourself up for a lot of problems. You may feel better in the short term, but you may not. I don't really have time today, but on the next podcast, I'll try to do it on the next podcast. I'm actually going to talk about why testosterone replacement therapy in men could be the wrong thing to do. So join me on the next podcast, guys. Listen, I appreciate you joining me and hanging out with me. I hope that these podcasts are adding value to your life and helping you to better understand your health, take your health back, be your own advocate. And it's my mission to help you change your life so that we can impact and improve your family's quality of life and ultimately your community and the world. And I want to do that by, helping you guys be better educated. Just remember, if you need help, don't hesitate to reach out to us. We do work with people. Primarily, the way that I work with people is I work with 1 to 3 new individual one-on-one clients per month, and that's it. So it's very limited in who I take on. If you're interested in having me help you investigate things, then you got to be ready to get some testing, guys. If you're not ready to get testing done and really dig, then working with me one-on-one's not the best thing. You might be a candidate for some of our group programs, like our Hashimoto's Transformation program, where we work with people in groups. We take small groups each month through the program so that we can give them really focused care. It's about a 3-month program, but we take people through in groups so that we can limit, spreading ourselves too thin and really only work with people that are really committed to getting better. And then beyond that, we have our detoxification program, which is, for some people, that's the place to start. Other people, it's not. But the toxins in our environment are absolutely unbelievably overwhelming. And we work with people, in groups to address toxins. And that might be needed prior to working with someone with a thyroid disorder. It just depends. But if you're not a candidate for working one-on-one with me and you're not committed 100% to getting the testing that I recommend and probably spending a few $1,000s on the testing, then that's not the right place for you to begin. I just don't have time to work with people, trial and error. If you want to get better and you want the best chance to improve your health, then we have to get the testing that we need to determine what's driving your problems. We don't have time for guesswork, and there's a lot of people that need help, and I can only spend so much time working with people one-on-one. So you got to be ready to get the testing needed that needs to be done. So, but you could work with us in maybe a group, which is, a bit more affordable. And then, if you're not in any of those places, that's okay as well, guys. Go to our Facebook page, go to our YouTube channel, listen to all of our podcasts, and start becoming empowered to help yourself. But we're here to help you out. And if you need anything, please reach out and let us know. Please, guys, share this message with other people because so many people need to hear this. Help us help other people by sharing the message. And please go and give us an honest review of what you think of the podcast. And I'm always looking for feedback on how we can make things better. And just know that we're here trying to help you out. And I do appreciate it. And I look forward to talking to you guys again soon. Hope you have a wonderful day. Thanks. Thanks so much for listening. We hope you enjoyed hanging out behind the scenes with Dr. Shook. You can also talk with and learn from Dr. Shook through Facebook Live on our Facebook page at the Office of Dr. Brad Shook. Don't forget, you can also get access to our videos, guidebooks, and thyroid programs at www.drbradshook.com. Oh yeah, and don't forget one more thing. We can change the world one person, one family, and one community at a time. Until next time, remember, today is your day, and no one will tell you who you are and what you can be.